Hello everyone. Today I am going to discuss a very important topic, that is investigations we do in order to diagnose pneumothorax. In previous class I had discussed about the definition and classification of pneumothorax, and in this class I would be discussing about investigations, complications, treatment of pneumothorax. So see, first is the chest x-ray obviously. So see, chest x-ray, standard erect chest x-ray is taken during the inspiration. We take it during inspiration. We do not take expiratory films. We take during inspiration. So on this chest x-ray you can see sharply defined edge of the deflated lung. क्या हो जाता है, लंग कोलैप्स हो जाता है. देयर इज कोलैप्स ऑफ द लंग मीन्स देयर इज श्रिंकेज ऑफ द लंग एंड फंक्शन ऑफ द लंग इज लॉस्ट. सो यू कैन सी शार्पली, उसका एज शार्पली डिफाइंड होता है. एंड ब्रोंकोवेस्कुलर मार्किंग्स होते हैं. देयर आर ब्रोंकोवेस्कुलर मार्किंग्स बिटवीन एज ऑफ द लंग एंड चेस्ट वॉल. दीज आर प्रेजेंट इन नॉर्मल इंडिविजुअल्स, बट इन न्यूमोथोरैक्स these bronchovascular markings are lost and there is translucency मतलब एक्सरेज पास होते हैं लंग से और completely पास नहीं होते हैं, और it is not completely black as in radiolucent, but it is translucent. There is translucency, means partial passing and visibility, and you can see there are absent bronchovascular markings are absent, which are usually present in normal individuals. मैं chest x-ray लगा दूंगा साइड में, so you can see on that, and edge is sharply defined. So basically you can see a clear visceral pleural line. Usually there is a visceral pleura and a parietal pleura, and in between there is a pleural cavity. So when air or gas enters inside this pleural cavity, it is called pneumothorax. There is collapse of the lung. So you can see a clear visceral pleural line. वो clearly visible होता है chest x-ray पे. और also the collapse lung होता है, उसका margin भी visible होता है. There is visible margin of the collapsed lung. So I would be talking about second part, that is CT scanning. It is done to find out accurate estimate of the size of the lung, and it is recommended in difficult cases like surgical pneumothorax. Surgical pneumothorax is a type of traumatic pneumothorax, means a type of iatrogenic मतलब जो treatment और diagnostic modalities interventions में pneumothorax cause हो जाता है. So basically that is surgical pneumothorax. It happens during surgery. There is trauma and it leads to pneumothorax. So it is CT scanning is recommended in such difficult cases. And also it helps to differentiate pneumothorax from suspected bullae in complex cystic lung disease. इस बुल्ले का मतलब ये है कि airfilled cavities greater than 1 centimeter in diameter. So it helps to differentiate pneumothorax from suspected bullae in complex cyst होते हैं lung disease. So basically this is about CT scanning. So now I would be talking about third part, that is ultrasonography. In this there are 4 parts. First is the loss of lung sliding. So usually there is normal sliding of the visceral and the parietal pleura during respiratory cycles, and it is lost during pneumothorax. This is the first part. Now second is the loss of comet tails. So it denotes interstitial pulmonary edema. So you should know this. This is second part. Third is the loss of the seahorse sign. Basically this seahorse sign is linked to the lung sliding. It is same, it denotes lung sliding. So basically there is loss of this lung sliding which denotes pneumothorax. So this is loss of seahorse sign. And barcode sign means in the M mode there are parallel lines, horizontal uniform parallel lines you can see on the M mode in ultrasonography. So you should know this is fact, barcode sign. So basically this is about ultrasonography. So now I would be talking about complications of pneumothorax. So there are 4 complications. First is the pneumothorax. From the name you can see it is empyema plus pneumothorax. Empyema means there is pus accumulation in the pleural cavity, and pneumothorax means there is air or gas in the pleural cavity. So basically उनका combination empyema plus pneumothorax, it denotes pneumothorax. So causes of pneumothorax are aspiration, And when you insert an intercostal chest tube, so there it can lead to pneumothorax, means it is iatrogenic. It is iatrogenic. Then it can also happen due to necrotic pneumonia, lung abscess, necrotic pneumonia, lung abscess, caseous pneumonia, etc. So basically there are many causes of this pneumothorax. So you should know this. Aspiration, iatrogenic, necrotic pneumonia, lung abscess, etc. So basically these are the causes of pneumothorax. Now I would be talking about hydropneumothorax. From the name only you can see there is air. It is a very rare condition, and air and fluid accumulate in the pleural cavity. So basically that leads to hydropneumothorax. Fluid and air, fluid plus air. And hemopneumothorax, from the name you can see hemo means blood. There is blood accumulation in the pleural cavity. Due to the rupture of the blood vessels, in the adhesions. As I have told you, there can be adhesions between the visceral and the parietal pleura. It is localized pneumothorax. So basically there is bleeding, there is rupture of these blood vessels in the adhesions, which leads to hemopneumothorax. And when the lung re-expands, when there is re-expansion of the lung, the bleeding stops. And if it does not stop, then the treatment is surgical ligation. Then there is surgical ligation. If you do surgical ligation, then this condition hemopneumothorax can be treated. ये treat हो सकता है through surgical ligation when the bleeding does not stop. So this is the third part. Now fourth part is obviously from the name you can see mediastinal and subcutaneous emphysema. Emphysema means reduced surface area. So exchange of gases is also reduced because there is reduced surface area. So basically this is mediastinal and subcutaneous emphysema. So basically this is about complications of pneumothorax. So now I would be briefing you about investigations and complications of pneumothorax. So first is investigations. Most important is radiological findings, and there are three. First is the chest X-ray, standard erect chest X-ray. During inspiration we do not take expiratory films, and on chest X-ray we can see the sharply defined edges of the deflated lung, and also you can see absent bronchovascular markings between the edge of the lung and the chest wall. So bronchovascular markings are absent, and there is complete translucency. And there is mediastinal shift to the opposite side. And you can see the visceral pleural line and the margin of the lung. Also you can see absence or presence of pleural fluid complicating empyema and underlying lung lesion. So basically this is about chest X-ray. Now second part is the CT scan. In CT scan it is used to find out the accurate estimate of the size of the lung. And also it is recommended only in difficult cases. Like surgical emphysema, means it is iatrogenic, means it is caused during treatment modalities. So basically it is recommended only in such difficult cases. And also it helps us to differentiate pneumothorax from the bulla of the complex cystic lung disease. So basically this is about CT scan. And third is the ultrasonography. There are four parts in ultrasonography. The first part is loss of lung sliding, then loss of the comet tail sign, then loss of the seahorse sign, and barcode sign. So these are facts, you should know this. So basically this is about investigations of pneumothorax, radiological findings. So now I would be talking about complications of pneumothorax. So there are four complications. First is the pneumothorax. From the name only you can see it is empyema plus pneumothorax, means pus in the pleural cavity and air in the pleural cavity. So basically that is pneumothorax. It can be caused due to aspiration, or it can be iatrogenic. Also it can be caused due to necrotic pneumonia, caseous pneumonia, lung abscess, etc. So basically that is pneumothorax. Second is hydropneumothorax. pneumothorax means air and fluid in the pleural cavity. It is a rare condition. So basically that is hydropneumothorax. That is the second part. Third is the hemopneumothorax, means from the name only you can see that is blood, there is blood accumulation in the pleural cavity. So it is caused due to rupture of the blood vessels in the adhesions, rupture of the blood vessels in the adhesions, and when the lung re-expands, when there is re-expansion of the lung, then this bleeding stops. And if this bleeding does not stop, then surgical ligation is the mainstay treatment. Surgical ligation is the mainstay treatment. So basically that is hemopneumothorax. And fourth is the mediastinal and subcutaneous emphysema. As you know from the name, there is reduced surface area, reduced total surface area. So decrease in the exchange of gases, So basically that is emphysema. Mediastinal and subcutaneous emphysema is the fourth complication of pneumothorax. Thank you.